It's protected under the law in terms of peaceful protests. So let's start on that particular note, because you're on the streets today agitating for your cause. And this is coming just the day after President William Ruto said that the wage bill is already bloated. Today, he said we must live within our means. This could be a subliminal message to the striking doctors and clinical officers and the laboratory operators. What does this message resonate to you, bearing in mind the tight fiscal space we find ourselves as a country?
I think when we talk about that, we need to actually break down the numbers so that we get to know where does this wage bill lie. Is it in the health sector or where is it? And we want to tell Kenyans that spending and paying healthcare workers is not actually more of expenditure. It is more of investment, because you invest in people's life. So it cannot be called expenditure and then you dismiss workers. Remember, we do not have enough staff. So we believe that the advisors of the president need actually to take him to update and inform him that we are below. Like today, if we had to go by our own policy, the staff establishment, we are supposed to have close to, in 2018, we were supposed to have close to 30,000 clinical officers in the country.
Okay.
We are now projecting close to 58,000. The government has only 6,948, those who are employed on permanent and pensionable, and others 800 who are on contract. So, and that is why we are saying this is not for healthcare workers, it is for the poor Kenyan who take more than 24 hours to 2 days waiting to be seen in a public health office, public health facilities.
Okay.
We are only asking that the president promised Kenyans that he will indeed change the approach in the health sector, and he went ahead, put it in his manifesto. And one of the promises he gave Kenyans is to employ more staff so that we can actually expand our coverage. Because coverage means that I get services when I need it and the way I need it.
Okay.
And it should not be delayed, and the cost actually will go down. Because if you have a patient who needs to see a specialist and must come from Migori to Nairobi, that cost has been transferred to that patient. And those are some of the unnecessary expenditure that we normally see patient actually suffering. And we are saying that in a well-projected, well-thought-of a healthcare system that is fully functioning, then we must be able to see a deliberate approach from the president and the leadership who are action-oriented to focus to ensure that one of the key pillars in the health sector, the human resource component, is well addressed.
Okay. So let's talk about deliberate action so far, because